This government meeting is brought to you by Eastworks and our local cable subscribers.
I'll make a motion to start the Board of Health meeting on April 9th at 5:31 p.m.
I'll second that motion. All in favor? Beth, yes.
Steve, yes.
All right. Welcome, everyone. I'm going to start by reading our opening remarks. In accordance with Mass General Law, we are required to let you know that this meeting is being recorded. We will begin the meeting with 15 minutes of public speak time, 3 minutes per speaker. Raise your hand if you would like to be recognized by the chair. Please note that during public speak, the board will be actively listening to your input for future discussion, but will not be responding to any comments at this time. Please do not speak unless recognized by the chair, and all comments should be addressed to the board. You can also submit a request or topic for later discussion via email to the health@easthamptonmass.gov email. All right. Our first item on the agenda is public speak time. Do we have anyone present for public speak? I'm looking at the list. It looks like all Board of Health related people. So it doesn't look like we have anyone additional added joining us. Okay. Second item on the agenda is approved meeting minutes from March 19th, 2025. Steve, did you have any?
No, I read through it. Everything was good. So I'll make a motion to approve the meeting minutes from 3/19/25.
I'll second that motion. All in favor, Beth, yes.
Steve, yes.
All right. Moving right along. Ryan Griffin is our new health director, and we're going to take a vote to vote him in. Welcome, Ryan.
Thanks, Beth.
Welcome, Ryan.
Thank you.
Nice to remotely meet you. So I appreciated your email. I, have heard enough about you to know that you will be a valued member of the team. So I am definitely ready to vote.
Yeah, I am as well. So I will make a motion to approve Ryan as the health director of the city of Easthampton and an agent of the Board of Health.
I will second that motion. All in favor, Beth, yes.
Steve, yes.
Well, welcome officially.
Congratulations.
Thank you. I appreciate it.
Is there anything you wanted to say? I'm not putting you on the spot, but just while you're our agenda item, anything you wanted to say to the full board?
No, not too much. I mean, I'd love to touch base after the meeting and just or sometime down the road, just so we could talk about some ideas. But other than that, no, I really appreciate it.
All right, very good.
Thank you.
Okay, mayor's office updates.
I don't see anybody present from the mayor's office.
Yeah, I was just gonna say. All right. So I'm not sure if she's coming. Has anyone heard otherwise? Okay. Well, we can move to the next agenda item. I think we have to make a motion to do that and then come back to it.
I can make the motion.
Mhm.
I'll make a motion to table item 4 on the agenda and move on to item 5.
I'll second that motion. All in favor, Beth, yes.
Steve, yes.
Great. All right. So then we will move to the health agent report.
Not too much to update this past month. Although we're in spring, which typically the housing cases go down, we did have a little bit of a influx of housing cases over the past month. We had 5 housing complaints less over the past 4 weeks or so. So I'm actively have gone out and done inspections or have inspections pending and have coordinated with Liz on a number of them because, per usual, they're typically unsanitary or hoarding situations, typically reported by like neighbors or first responders. Camps, we're starting to prepare for that. I sent out a memo to all of our camp operators a week ago. We're expecting 7 so far, so a little bit on the lower end over the past like 4 years since I've been here. And I think just Williston has just dialed back on some of their camps. But we will be having a virtual training with the camp operators sometime this month. It's mandatory. We make them all view that presentation just because how complicated the camp process can be each year. Although they do it every year, it can still be a bit overwhelming. And just in general, like I said, we had 5 housing complaints, 3 regarding trash storage, which is pretty common as we're getting into this time of year. And then a trash hauler complaint. An individual complained about dumpsters being emptied at an apartment complex at out of the Board of Health admitted hours. So I communicated with that, and that should be resolved. Yeah, and just as of right now, I'm just currently been fairly occupied with some of the mandatory state training that that they're requiring health agents or health department staff to do. I'm in a pretty extensive housing training currently right now. So that's pretty much it.
All right, great. I reviewed your update. I didn't have any questions that popped out.
Okay, great.
Yeah, me either. I know we were going to follow up with the East Street property. Are they going to be joining us next month?
Yeah, yep. Actually, I've communicated with the owners. I spoke with them right after last month's meeting, and I told them that, reminded them that they're slated to be on the May agenda.
Okay.
So they are, as far as I know, they are fully moved in at this point, and they were fully connected to city utilities, and everything was done in the right manner. But they can hopefully provide a little bit more of an update in regards to like the timeline that they need for, from this point forward.
Sure.
Great.
All right.
All right. We will move on to our social services update.
Hi, everybody. I'm also managing my 2 children here at the same time. So I just wanted to obviously highlight that, housing, financial needs around housing, all of that continues to kind of be a front runner for needs for people. I did do a bunch of events and outreach in March, which was really kind of nice to get out and about, back connecting with people again. We have a bunch of events and things coming up over the summer. So hopefully, that'll all be able to still go on. A lot of our social and human service agencies that we collaborate with are facing some real challenges with funding right now. I reached out to Elder Services for something yesterday, and they said, like, our funding is frozen and we just can't help you. So I'm trying to keep that in mind because I think it may show up in some of our events and some of our outreach efforts. But, I think everybody across Western Mass is still trying to do as best as they can, with getting things done. So we'll see. And obviously we'll get creative where we have to. But, I think people are just trying to take care of what they can. So no shortage of work, that's for sure. But everything otherwise is good. I don't know if anybody had any questions on the report.
I did not have any questions. Thank you for the thorough report and all the work you're doing.
Yeah, thank you. It must be tough out there for some people right now.
Yeah, I mean, I think what's great is we have options like helping people with draft applications, and we have great organizations like Friends of Easthampton Council on Aging and Helping Hand, and some of these really helpful groups both in Easthampton and across Western Mass. And there's a lot of community conversations going on. So I'm trying to catch as many of those as I can. I just, looking at like some of the events and things that we'd like to do coming up, my hope is that, we can still do all of those things, and that the funding piece won't be too much of an impact. But I think, just kind of keeping both in mind. So.
Okay, thank you.
Yeah. And so my question at the beginning of this was just if the board and Ryan, if we can hang out when the meeting is done. We have a time sensitive matter that I just wanted to run by you guys ahead of tomorrow if you have 2 minutes. I just didn't want to do it during the meeting while everything's being recorded.
Sure.
We can't hang out with the board and me. We could do it individually if you'd like, Liz.
Okay. Yeah, I forgot. Whatever's easier. I just wanted to pick somebody's brain before tomorrow. Thanks.
Okay. Before we move to the next agenda item, Erza, you had your hand raised.
Sure. I want to apologize because the agenda that you have in your hands is different from the one that was published. I made a change to the agenda that Ryan had asked me to do because he wanted to discuss something and it was the first item in the agenda. So I don't know how we're going to go about that. And I do apologize because I didn't send the updated agenda to you guys.
So this agenda item was the official one published for the public, correct?
Yes.
So I think then we should address it. What was the agenda item?
It was just a health director update, and he wanted to talk about Ryan. I'll leave that to you.
I just wanted to discuss with the board some ideas I had in regards to food inspections.
Okay, why don't we make a motion to move back to what would have been item 1 on the agenda before moving on to the next agenda item.
Sure, I'll make a motion to go back to the published version of the minutes
Not the agenda.
of the agenda, for today's meeting.
Okay. I'll second that motion and amend it. We will go back to what should have been number 1 on the agenda that was published for the public.
I'll second that motion.
All in favor, Beth, yes.
Steve, yes?
Okay, Ryan, you're up.
So not too much to update. It's been a really exciting 2 weeks. I'm very appreciative to the staff and how supportive they've been to me. Just a couple goals. Ideally, I'd love to be fully staffed, and as well as working with shared services and the mayor's office on getting some technology into the health department, which I think would be a huge help. But one thing Brian and I have talked about is transitioning food inspections back to the Easthampton Health Department. Between Brian and myself and the assistants from shared services, it would be about 5 food inspections between each of us monthly. So it's just something I wanted to run past the board and just emphasize the importance of us being out in the community, our presence in the food establishments, as well as just setting expectations prior to reaching out to shared services and asking them to split the inspections back with us.
Yeah, I mean, I think that sounds great. I know you have experience in this, so do you need any kind of onboarding time, or you feel you could begin this right away?
I feel I could begin this. Ideally, I'd like to start at May 1st.
Okay.
Is there any training that you have to sign off on, or SOPs you have to read, or anything like that?
Not too much.
Well, I certainly support that. And I think we can probably, as a board, approve that today.
Yeah, I think it is important to, show the health department's face more. Oftentimes I'll talk to people in the community and, they're not too familiar with what everyone does. So,
Exactly.
Beth, do you want to make a motion?
Yeah, I'll make a motion to, starting May 1st, to have Easthampton's Health Department take over inspections.
Transition back. Still with some help with shared services.
Transition back to doing inspections in Easthampton splitting with shared services.
I'll second that motion.
All in favor, Beth, yes.
Steve, yes.
Perfect.
Very good.
Thank you.
Thank you, Ryan. Anything else?
Nope.
Ryan, no? You're good? Okay. All right. So now we will return back to our next item on the agenda, the public health nurse update. Your last update.
My last update, yes. The only thing that's not added to this agenda is I did the COVID vaccine clinic at the Council on Aging, and I had 3 people signed up, but I actually got 9 people by dragging them in from the hallway. And so, yeah, it went pretty well. And I talked to the Northampton nurse there, and we're going to have another formal meeting with Ryan at the end of the month, and just to transition some of my services with them. And yeah, so we're just working on that.
That's good.
Do you have any questions? I'm here basically to see if there's anything else that you want me to do before I leave.
Is there like
No,
a
I mean-
resource binder for the?
Is there what?
Is there like a resource binder for the position?
Yes, that's what, yes.
Yeah.
Yeah, I'm getting that all together now and all of my contacts and everything. And I've already shared it with Ryan and Irsa. So,
Okay.
yeah.
Well, I wish you well.
Thank you.
Yeah, good luck and thank you for your service.
Thanks so much. It's been great.
All right. And yeah, we're on the last item of the agenda. And I do not think we have Lindsay from the
I don't
mayor's office.
see her, but I did have a request for next month. I'm not sure if we can move the meeting. I'll be out of state on the 14th on vacation.
Oh, absolutely. Yeah. So the Board of Health meeting is typically, I always forget, the first Wednesday of the month, does anyone know?
Yeah,
It's usually the second. Okay.
I could do the 7th,
Wait.
21st, or
Sorry,
28th.
I meant the city council meeting. I
Oh, yeah.
apologize.
Okay.
I know when our meeting is. Yeah, city council meeting is typically what, the third?
I want to say the first. I should check the website. Brian, do you know off the
Okay.
top of your head?
I want to say the 3rd because I'm not 100% sure, but I remember last month.
Yeah, we
did it-
moved it the week after.
We moved it a
right?
week back, and it was the same. That ended up being the same week as same day as city council. So I'm assuming I think it's the 3rd week of or 3rd Wednesday of every month that city council meets.
Got it. So what were you thinking, Steve?
Oh, like I said, I could do the 7th, 21st, or 28th.
Why don't we do the 21st? Because I think going a week earlier would be, like, I'd say give it a little extra time as opposed to earlier.
Okay. Do we have
Does
to
that
vote
sound
on
good?
this?
I don't think so.
Okay.
Just real quick, Beth. On May
Yeah.
21st at 6 p.m., City Council has an in-person meeting.
Oh, so maybe it is the 3rd.
Okay.
So why don't we do it on the 7th then?
Okay. Let's
Does
do
that
it
work
this
for
week.
everybody?
City Council also has a meeting May 7th.
And I'm out.
28th then. For
Okay.
the-
I really appreciate it too.
No,
Thank you.
no, it's fine. I just, looking way ahead, I just, that means we'd meet like 2 weeks later. So I don't know if we want to talk about that, but, I guess we can meet on the 28th and go from there.
Okay. I appreciate it. That's all I have.
All right. So if I have no other, unanticipated agenda items, so, unless anyone else has any comments, questions, concerns, we can
Adjourn.
adjourn.
Okay. I'll make a motion to adjourn the Board of Health meeting at 5:50 on April 9th.
I'll second that motion. All in favor, Beth, yes.
Steve, yes.
Cool. Thanks, everybody.
This government meeting is brought to you by Eastworks and our local cable subscribers.